So today we welcome Clare Matthews, who is a GP and is going to talk to us about her career, her path to get to that career, what she enjoys, any challenges that she has, and also any tips that she might have for any students right now, whether they be in year 7 to 11 or whether they be for our sixth formers who are looking to apply to go into medicine. So thank you for being here, Clare, with us today. Also, you are a mum of Charlie, who is with us at SPH, so welcome. Can you start by telling us a little bit about your career? What do you do?
So I'm a GP. Most people know what a GP is because most people have been to see one. GP is quite a broad description nowadays. It used to mean that you were just a person sitting in a practice, but there's all sorts of GPs now. You can be a GP partner, so own and run your own practice. You can be a salary GP, so just get paid to see bums on seats. There are lots of sort of portfolio GPs who do a bit of GP, bit of other stuff as well on the side, whether it be Botox or dermatology or whatever floats their boat. So there's lots of flexibility in general practice. I've always been quite interested in education as well. So I'm a GP trainer. So I train up new GPs, and I'm an examiner. So I examine for the Royal College. So when you do your GP training, before you allowed to be let loose on the general public at the end of it, you have to pass your MRCGP, which is your membership of the Royal College of General Practitioners, and I'm an examiner for that as well.
Oh, busy lady then.
Yes.
When did you know that this is a career that you wanted to go into, Clare?
Well, I'm slightly unusual in that I wanted to be a doctor from the age of 7, which of course when you're 7 everyone just goes, oh how sweet, that's nice. But my brother had cancer when he was 9 and I was 7. He's fine now, by the way. He's 6'2" and a lawyer and perfectly fine. So being a doctor is a good thing because it makes people better. But yeah, so when he was very poorly, he was an inpatient at Great Ormond Street and had chemotherapy for a year, and I remember sort of sitting and trying to look after him when he wasn't very well and thinking, I'd quite like to do that. That looks good. And just sort of never really changed my mind. You know, when I was, I guess, probably 14, 15, my parents had said, you know, you don't have to do this, don't you? You are allowed to change your mind. And so I looked into a few other things, psychology, physio, you know, teaching, but also I thought, well, actually, no, I think I do. Yeah, that's what I want to do. So for me, it was actually quite easy because when it came to GCSEs, what to choose, it was just like, well, if that's what I want to do, that's what I've got to do. And A-levels, it made my sort of choices a lot easier. Yeah. And I think for people who aren't knowing exactly what they want to do, that's quite hard to know what to choose sometimes.
Okay, so what career path then did you take? What did your path look like?
So I did GCSEs and then I did 3 sciences A-level, so physics, chemistry, biology. I had a gap year, and I think everybody should have a gap year because it was one of the best things I ever did. And actually, when you get to university and you get on the treadmill, it's kind of hard to then get off at any point. So if anyone's thinking about it, I would say that's a really good thing to do. I spent 6 months working as a secretary and 6 months in Israel working as a volunteer in a hospital in Jerusalem, which was amazing. And then I went to Southampton University, so 5 years at Southampton University, during which time I sort of thought I probably wanted to be a paediatrician, so looking after kiddies, which is kind of the direction I'd always kind of wanted to go. But then when you come out of your university career, you have to do a year as a junior doctor, as what was then called a house officer. You're now a foundation doctor. When you're doing all the busy on-calls and the long hours and all of that sort of stuff. Yeah. And I realised that actually if I wanted to be a paediatrician, all the long hours and the on-calls and the overnights were a big part of that. And I didn't really like doing that at the age of 25. So I thought, well, when I'm 35, 45 and 55, I'm going to like it even less. So I started looking at general practice. So at the end of my foundation year, I joined the GP training scheme in Salisbury, and that's then another 3 years of training after your foundation year. So 9 years from start of university to when you come out the end as a proper real life GP.
Wow. Can I go back to you taking a gap year?
Yeah.
Did you apply to university during your year 13, or did you apply during your gap year?
I applied during year 13, so I went into my gap year knowing I had a place at Southampton.
Yeah. Okay.
So I could have a nice jolly time on my year off, knowing at the end of that I had something useful to do with my time.
Okay. What does a normal day and a normal week look like for you, Claire?
So again, I mean, it's really variable, and I think that's the really nice thing about general practice and most of medicine generally, is that it is really flexible. So I have changed my days, my hours, my practice quite a lot. So I qualified in 1999, which makes me sound very old. So I've been a GP for sort of 15 odd years, and I've worked everything from, so we work in sessions, so half a day is a session. So I've worked everything from 8 sessions, 4 days a week, which counts as full time, because it's a hard job and not many people can do more than 4 days a week and remain sane. Mm-hmm. So 8 sessions is full time. So I've done 8 sessions, I've done 4 sessions after having Charlie, done 6 and 4. I'm doing 6 sessions at the moment, so 3 days a week. I work Monday, Tuesday, Thursday, so hence I'm here on a Friday because it's my day off. Although my laptop is underneath my iPad because I've just been doing a bit of work from home. But yeah, so it is quite flexible, and I think which makes it a nice job to do if you're planning families and that sort of thing. But yeah, typical day, I am in work for 8 o'clock, and I work right through till 6:30, and don't usually get much of a break in between, because it's a busy job, and nobody's going to go into medicine thinking it's an easy job and restful.
How have you seen your role as a GP change since you first qualified?
So the role has changed and the job has changed, I think. So the role has changed for me because when I was finished my training, where I was working in Salisbury, there weren't very many salary jobs. So I thought to myself, I'm either then going to have to be a partner, which is quite full on and lots of responsibility, or a locum. So a locum is a temporary doctor. So if someone's on holiday or off sick, a locum goes and fills the gaps. So you're somebody who's plugging gaps in other people's surgeries. So you've got no sort of continuity and no kind of team around you to support you. And to be quite honest with you, both those prospects terrified me. I thought I'm too scared to be a partner. I'm too scared to be a locum. So I went and got a solid salary job, which is how I ended up down here. And that was quite nice because you haven't got all the responsibility of running the business and organising everything. You see the patients and you go home, which is quite nice. But after 10 years of doing that, actually, perhaps you want a bit more responsibility. And so I decided that actually that was the time I'd quite like to be a partner. And so I've been a partner in my surgery now for 5 or 6 years. And it's very different because you have a lot more different stuff to do other than just doctoring. But it's really interesting, and you get much more involved in the sort of local politics of managing health and that sort of thing. So that's sort of how my role has changed, but I think patients have changed quite a lot as well. People's expectations of what they want from their doctor are going like that, and most people know what they want when they come, and they want it yesterday, and why haven't you done it already? So I think it's going to be interesting to see how that changes. Some of your guys end up being doctors in 5-10 years time, what that will look like for them then.
So what other challenges do you face on a daily basis?
Dr. Google is
Yeah.
quite a big one. So I have a mug on my desk that says, please do not mistake your Google search for my medical degree, which my parents gave me. And occasionally I do shift that into full view. So a lot of people go, I Googled this and I think I've got a brain tumour, or, you know, so people's sort of health understanding sometimes can be a bit challenging. And I've read that I need this rare and expensive drug that isn't funded on the NHS. No, sorry, we can't do that. So I think patients' expectations are probably one of the biggest challenges. Time is always a big challenge, you know, when you've got a life as well as a job. You know, the clock watching at the end of the day, obviously not at the moment because the children are at home, but I've got another one other than Charlie, and she's at primary school, so you know, the sort of school runs and the fitting life around the job, that's always a bit of a challenge. But as I say, general practice is quite flexible, and I have friends who are consultants, you know, consultant paediatrician, consultant in sports medicine, and they all manage to fit family and life around the job, so it is doable.
Yeah. What advice do you wish you'd have had when you were looking into this, Claire, that maybe you didn't get?
Ooh, that's a tricky one. I mean, I think the more work experience you can do, and I know it is hard to come by, but I think if you can go and be in a practice, even if it's just helping reception, just so that you can see what comes through the door, what challenges they face, you know, with patients ringing in. So you just get a feel of this is what being in the NHS is like. Because it's not for everybody, certainly. And so I think the more you can sort of see face to face, the more chance you've got of knowing you're doing the right thing, and talking to people who are in it and doing it, whether it's nurses or doctors or you know, porters, or you know, I think everyone's seen with the pandemic that the cleaner in the hospital is just as important as the porter and the nurse and the doctor, because no one of those people can do their job without the other people. Yeah. So I think talking to anybody you know who works in the NHS does help to sort of open your eyes a bit to how it works. And you know, we're all just tiny cogs in a sort of gigantic machine. In terms of advice, gosh, I'm not sure really. I'm
thinking both for, I guess, those students who are anywhere between 7 and 11 and still thinking, or even 7 to 9, those children who haven't decided on their GCSE options yet, but maybe, you know, are thinking about going down this route. And then those who are in year 12, who are just about to be applying to university. You know, how did you decide on Southampton, for example?
Yes, I mean, for people who haven't got a clue what they want to do, I would just say do what you enjoy, because, you know, if someone's trying to pressure you to do medicine or law or this and that, and actually you think, God, that sounds awful, do what you enjoy, because you spend an awful lot of your life at work. And if you end up doing something you hate, you will be miserable. So if you do the subjects that you enjoy, then you will enjoy doing the subjects. When you get to the end of doing those subjects, something will come up and your direction will become more clear. But if you're doing, you know, if you're making yourself do stuff that you don't enjoy because you think you should, you will regret it forever. And yeah, for example, my brother has ended up being a lawyer, and he hates it. And he has spent most of his working life trying to get out of being a lawyer.
That's tough.
Yeah, and because you do spend so much of your life, I mean, imagine your schoolwork life, and treble and quadruple it, that's how much time you're going to spend at work. So please make sure you enjoy it. And money isn't everything. You know, if you want to do something that doesn't pay very well, if you're happy, go for it. You know, being a lawyer just because you think you're going to get paid loads. don't.
Right.
In terms of the courses as well, Southampton wasn't the most prestigious university to go to do medicine, and I got places at other universities that might have been considered, posher. But looking at the course that you're going to do as well, and thinking, am I going to enjoy that course, and does that fit with the way I work? So most courses now do what Southampton did when I started, but it used to be that you did all of anatomy and all of biochemistry and all of physiology in those big chunks. Whereas Southampton did it that if you're doing the cardiovascular system for a term, you do all the anatomy, physiology, pharmacology, and everything that goes with the cardiovascular system, which to my mind is a no-brainer. Why on earth wouldn't you learn it like that? So I chose the course based on the way they organised the learning, and it was great, and it worked for me.
Okay. Finally, any other tips that you would give to our year 12s who are wanting to go into medicine?
I think the work experience thing and talking to people is probably the best of it. I think if you can, pick your university carefully. If you're going for somewhere miles and miles away from home, make sure that you want to be miles and miles away from home, because again, it might seem appealing to get as far away from your parents as is physically possible, but actually when it comes to the logistics of carting all your stuff up and down and the reality of being that far away, and if you want some help with your washing, that sort of thing. So it's just sort of thinking about the practicalities of it all as well, as well as the sort of, more money related and career related stuff, just being a bit practical.
Did you enjoy your time at uni, Claire?
I loved it. Yeah.
What did you love most?
So you get to live with your mates, which is really, really good. So, what's not to like? So you start off with a year in halls of residence. You're on a corridor with, a load of like-minded people. You're doing the thing that you've always wanted to do. You're learning. Yeah, you've got to work, but you're working at stuff that you want to do. Whereas, perhaps if you're in year 7 or 8 at the moment and you hate history or maths or whatever it is that you don't like, and you've still got to do it, you're learning stuff that you want to learn to do a job you want to do. And there's so much opportunity for expanding your horizons. So again, I'm quite into acting and all that kind of stuff. So I joined the theatre group, and we had the Medics Review, which ended up in us taking a show up to the Edinburgh Festival. So you can do sports, you can do whatever you like. University is just you arrive and then it's kind of like, wow, there's all this stuff to do. So university is brilliant, and you get to sort of flex your independence muscles with still a little bit of a string back to home. So university is highly recommended for anybody who's thinking about it.
If you were to go back and change anything, would you?
No, actually, I think I think I would definitely do medicine again. It's really hard work. 5 years at university, you get the additional bonus of having a couple of extra years at university, which is good fun, but you do have to work jolly hard. Yeah. You might end up, depending on what career you want to go into, you might end up having to move around the country a bit, following your career, which can be tricky. And being a junior doctor, you work really long hours, and it's, I think my longest week I worked 120 hours one week, and there are people who do that on a more regular basis. I was in quite a quiet district general hospital, so don't go into it thinking it's you're not allowed to do that, actually, by the way, anymore. There are European working time directives and things like that, which mean you're not allowed to do that anymore, but you do still have to work jolly hard, and it's a full-on job. But if you if the medicine ticks the boxes in your brain and you want to help people, they always said to me, if you go for an interview at a medical school, don't say I want to help people, because that sounds so corny and you know, really cheesy. But when I was sitting in my medical school interviews, they were, why do you want to do medicine? And I was like, I know I'm not supposed to say it, but I do actually really want to help people. So,
I sat in on a getting into medicine webinar only the other day, and they were saying exactly the same thing to the students. So you've got to show your passion, and you've got to show that you're doing it because you want to help people, but you're not allowed to say it, or you're not advised to say it.
But people, human beings are endlessly interesting and amazing and different, and the stuff that comes through the door is mind-boggling. And sometimes you think you're sitting there, you know, EastEnders is boring compared to some people's lives, and it's quite a privilege to be able to sit there and people tell you everything, and people do tell you everything. And that's quite a privilege for people to let you into their lives like that, and then and for you to be able to be given the opportunity to help them.
Yeah. Well, on that note, Claire, I will draw it to a close. Thank you so much. I know that what you said this morning is going to be useful for any of our students through from year 7 up to year 12 right now. So thank you very much, Claire. And if any of our students do have any questions, I'll point them in your direction.
Ping them my way, no problem.
Thank you, Claire. Take care and see you soon.
Yeah, okay, bye.
Bye.